All right, let's kick it off. I want to thank everyone for coming this evening, attending our patient-to-patient webinar, sponsored by the Setting Scoliosis Straight Foundation as a part of the June Scoliosis Awareness. So thank you all for attending. I know everyone has busy schedules, but we have a great agenda for you guys tonight. Next slide, please, Harvey. So I'm Josh Pahys. I'm a spine surgeon from the Philadelphia Shriners Hospital for Children. And my colleague, Dr. Ben Roye from Columbia University, will be our moderators for the evening. And next slide. And I'd like to, it's a real pleasure to introduce our guest patient speakers tonight. Dickie Davis, Riley Sullivan, Maura, Pauline, and Madelyn Reitsma will be talking to you guys and giving everyone here some very valuable sort of information, and they're sharing their experiences, their journeys through scoliosis, which I think is just fantastic that they volunteered. And I really look forward to their talks. Next. So just a little bit our strict instructions. Not really. This is meant to be an interactive webinar, which is really cool. So we'll listen to some great talks. But during that, if you guys have any questions, we really encourage you to send them in as the speakers are talking or right after. There's a little Q&A section at the bottom there. Just click on that. And Ben and I will kind of keep an eye on that and ask those questions of each of the speakers after the presentation's over with. So please, again, as everyone's talking, feel free to send in your questions. We want to make this as interactive a process as possible so you guys get the most out of these great speakers. Next slide. All right, so here's our agenda for today. Dr. Roye is going to give us a little talk on Scoliosis 101 and the latest in bracing. And then I'll wow you guys with the latest in surgical treatment for scoliosis. Dickie will give us a talk on what it's like to have spine surgery in 1962. And then we're off to Riley Sullivan will give us a talk at what it was like wearing a brace for 6 years and then having a spinal fusion. Then Maura's got a great talk for how I continue to swim after a spinal fusion. And finally, we'll wrap it up with Madelyn, who's going to give us share her experiences on vertebral body tethering. And then we'll close it out with some other fun slides at the end. So a little bit about the Setting Scoliosis Straight Foundation. We're a nonprofit 501c3 established in 2018 as a part of the HARM study group. Our mission is to better discoveries and to advance techniques in the treatment of scoliosis in children and adolescents worldwide. Our vision is really a future where children with scoliosis have the ability to live happy, healthy, and productive lives. So it really is research is kind of our middle name, and that's how we're working to really move the needle here on how we take care of kids with scoliosis, and we can improve their lives moving forward. All right, so it gives me great pleasure to introduce my distinguished colleague, Dr. Benjamin Roye from Columbia, who's going to talk to us about Scoliosis 101 and the latest in bracing treatment.
All right, thank you very much, Josh. I'm just going to get my talk loaded up here. Hopefully you all can see it. Great. Okay. So thank you for that introduction and good evening, everybody. My name is Ben Roye. I'm a pediatric orthopedic surgeon at Columbia. And as Josh said, I'm going to talk a little bit about some of the basics of scoliosis and an update in brace treatment. So scoliosis is really defined as a curvature in the frontal plane of the spine. So that means what the spine looks like when you're looking at somebody from the front. We also call that the coronal plane. And we consider any curve of 10 degrees or more to be abnormal, and that would then be scoliosis. And we measure this curve by the intersection of the most tilted vertebra, those are the spine bones. So this is a blow up of the picture on the right there, and we can draw a line off the most tilted vertebra at the top of this thoracic curve, and another one off the top of the bottom most tilted curve. And the way that those lines intersect, that angle would be your Cobb angle, which is how we measure scoliosis. However, it's really important to remember that scoliosis is not just a problem when you're looking at somebody from the front. And it's important to remember that scoliosis is really just a two-dimensional representation of a three-dimensional image, just like a photograph. A photograph may sometimes look a little bit three-dimensional, but it really is completely flat. And scoliosis does affect the way your spine looks from the side. It can either create this increased forward curvature, which we call kyphosis, or more commonly in idiopathic scoliosis, it causes decreased kyphosis, which actually can significantly impair breathing, especially when severe cases. Now, scoliosis also affects the axial plane, and this is what your back looks like in cross section if someone were kind of, cut you in half. What happens is the vertebrae rotate, and this leads to the chest wall rotating as well, which causes this rib prominence where one rib looks taller than the other. Now, it's hard to see when you're looking at someone from the back, but this is a patient, and the back looks pretty symmetric, except for maybe some asymmetry in the waist. But when she bends forward, and this is the typical screening test for scoliosis, you can see pretty clearly that the ribs on the right are much higher than the ribs on the left. And the reason for this is that these vertebrae are rotating. So this is a CT scan of one of the vertebrae right there at the middle of her curve. And as this bone rotates, you can see now how the ribs on the right are now higher, closer to the top, and the ones on the left are lower. And this is exactly what's happening in people with scoliosis. So why do we care? Well, treatment really needs to account for all three dimensions. The frontal plane, which is kind of what we usually think about, but also the sagittal plane, and that's the side view or the kyphosis we were talking about, as well as the axial plane, which causes that rib asymmetry. And ignoring the sagittal plane, the side view, and the axial plane can really compromise results. So that's why we care. All right, so let's look at these in respect to bracing. So bracing is basically a plastic shell that holds your back in a straighter position. And traditionally, patients have been supposed to wear the brace for up to 23 hours a day, which is hard, if not impossible. The goals of bracing have really traditionally been to prevent the curve from getting bigger, or hopefully at least prevent surgery. However, historically, there's been little faith in the effectiveness in bracing because there was little evidence and the research wasn't great. But a lot has changed, especially over the last decade. So what happened? Well, first and foremost is the BRACED study, which was published in 2013, which was the first definitive study to show that bracing works for idiopathic scoliosis. This was an actual randomized clinical trial, which almost never happens in orthopedic surgery. And it really changed the perspective of surgeons in North America. And there's really been growing acceptance ever since and an exploding body of research. Brace design has really evolved as well. Modern braces really embrace and respect all three dimensions of the spine. And these so-called 3D braces are really all the rage right now. Most brace manufacturers really promote what they call a 3D brace because it's really understood that just making the spine look better from the front is not enough. There's also just been, as I mentioned before, a ton of research. Now, unfortunately, there really is no standardized brace protocol. And if you talk to 3 or 4 patients who wear a brace from 3 or 4 different doctors, you're probably going to get very different stories of what they were told when they started their brace and things like that. There are so many factors to consider in bracing. First of all, when do I start? How old should the patient be? How big should their curve be? What type of brace am I going to use? There are dozens of different brace types out there. How many hours a day do I need to wear the brace? How do we monitor this patient? How often do we get x-rays? And how do we stop the brace? All of these things, there's really no standardization for. So to try to help with this, we've done, I led a group of orthopedic surgeons and orthotists. They're the people who make braces, physical therapists and physiatrists to try to develop guidelines, at least to give broad general ideas of what we should do when we're considering starting patients in a brace. And one of the things which we came up with is this bracing checklist, which we're not going to go into detail with, but basically it gives people a starting point for how to put somebody into a brace and how to do research going forward. Now, for part of that research that's been done since then, we talked about the axial plane before. Well, we now know that patients with braces that reduce rotation in the brace are 85% less likely to fail. And right now we're doing a prospective multi-center study looking to provide further evidence for this really, really important fact. We're also doing research looking at the impact of part-time bracing. Now, I talked about how traditionally patients have been in braces for 18, 20, 23 hours a day, but it seems to be there's a large group of patients that can benefit from being in the patient for maybe half a day, which is a lot easier. And this is especially true for certain conditions of patients who qualify for what we call a hypercorrective brace that can actually overcorrect your curve, or perhaps also smaller curves in younger patients. Another thing we've been rethinking is our goals of treatment. As I've said, I think once or twice, the traditional goal has been to kind of slow progression and avoid surgery. But new research has really shown that a lot of curves can improve with brace treatment. This isn't everybody, but generally smaller curves in younger patients. And we just published a study showing that up to 70% of our patients who met these criteria improved their curves at 2 years of treatment. So that's really important work. This is sort of a case study from the studies. This is a 12-year-old girl who hasn't had her first period yet, still growing at the 30-degree curve. After 1 year of bracing, her curve is down to 20 degrees. After 2 years, it's down to about 15 degrees, and she's basically mature at this point. So this is not the natural history. So we are actually modulating the growth of the spine with the brace, which is really like just amazing and fantastic. And finally, to help us collect this data, there has to date been no national multi-center brace registry in North America. Setting Scoliosis Straight is part of a HARMS registry, which looks at surgical patients. But just this month, we started a brace registry for brace patients with juvenile scoliosis. And right now, with the help of HARMS and Setting Scoliosis Straight, we're looking to get funding for a registry for idiopathic adolescent patients as well. So really important work. So just to summarize, scoliosis is a complicated three-dimensional problem. We really need to look at all three dimensions when considering treatment. Bracing works. It is definitively works. We have a great randomized clinical trial showing this. We are developing guidelines to reduce variability in the way we prescribe and use braces. We're doing research to maximize outcomes, and we're creating national multi-institutional registries to help track our patients. Thank you so much. All right, I'm going to stop my share.
Outstanding, Ben. Thank you very much. Really great introduction and comprehensive sort of overview of bracing now. So really appreciate that. I just want to first we had one question, a couple questions. One will a bit more surgical, so we'll probably touch on that during the surgical piece. But Mark wanted to know can bracing help a senior, an 80-year-old who has had no treatment at all, but has a rather serious scoliosis? So can you touch on can bracing be helpful for mature patients, older patients?
Absolutely. So I think bracing can be helpful for patients of all ages. It really is just a question of what are the goals of bracing. So generally for the younger patients, for children that are still growing, the goals of brace treatment are to prevent progression, maybe help the curve get a little bit better, and hopefully prevent surgery. And as patients get older, there is still a role for bracing, but it's generally a little bit different. There's a lot of patients who have large curves, have a very difficult time with function. They're having a lot of pain. Physical therapy hasn't been adequate to helping control that pain. They don't want to do surgery for any of a variety of reasons. Maybe the complication rate is too high, or they're not good surgical candidates because they have other illnesses. And in that setting, bracing has definitely been shown to be very effective in helping to help them feel better. They have less pain and they're able to do more. So I think in that setting, there is absolutely a role for bracing in older patients.
Excellent. And then one last question from Nirav Shah. What types of braces reduce or minimize axial rotation?
So there are lots of different types of braces out there. I think
loaded one.
Yeah, right. I know. So what I will say is that what I consider the standard and original three-dimensional brace is something called the Rigaud-Chenot brace, which was developed in Europe, about 25 years ago or so. And it really was the first brace to truly respect and try to realign the spine in all three dimensions. And they've had really tremendous outcomes. And it's the brace that we use at my institution, and many other do as well. Having said that, there's lots of other brace designs that have sort of mimicked what they have done with the Rigaud-Chenot braces to try to do that. So I think the one that's best known for doing that would be considered the Rigaud-Chenot, but there are certainly many others. Boston, which is sort of the most commonly used brace, has a 3D version, which also addresses axial rotation as well.
And then last one, if you're after a spinal fusion, years after a spinal fusion, can you brace that type of curve?
Again, I think the question really is, what are our goals of bracing? Why are we putting somebody in a brace? We don't generally need to brace patients immediately after surgery because our implants are strong enough to maintain that. However, if there's a secondary curve that maybe wasn't operated on that's getting worse, that might be a reason you might want to wear a brace. Or again, if they're having difficulty with pain and which is not adequately managed with, maybe over-the-counter medications, physical therapy, things like that, then bracing might be something that could potentially be helpful. Excellent. All right, a couple more questions coming in, but in the interest of time, and Ben, you can type some of those answers while I'm babbling away about I'm introducing myself, sorry, latest in surgical treatment. Okay, I'll let you do that.
There we go. All right, I'll share my screen. But yeah, Dr. Roye, I'll try to answer some of your questions as I'm chatting away here. All right. All right, everybody. We're going to talk about the latest in surgical treatment for adolescent idiopathic scoliosis. I'm Josh Pahys from the Philadelphia Shriners. So a lot of you are probably here because at some point or another you had a school screening or pediatric exam where they had to bend you forward, and hopefully it wasn't in front of all these people, but this is how I was diagnosed. And they tell you have a hump, which is a terrible word, but that can sometimes happen. So, but I just want to remind everyone here, you're in excellent company. Certainly currently there's a great group here. So you can be a famous cellist, an Olympic level swimmer, the fastest man on the planet, a princess, or a very pale, tall redhead who wore a brace when he was in high school and never ever complained about it. So how do you treat scoliosis? Dr. Roye gave us a great talk about the sort of more mild or moderate curves. As they get a little bigger, typically over about 50 degrees is when we'll consider surgery, as those curves will more often than not continue to progress into adulthood, even if you're not growing. But then there's the big curves like this that sometimes require more than one surgery. So our goals really are just to get a balanced trunk, and long and short of it is get your head above your bum and make sure that we have good correction in both the front from the side and that axial rotation that Ben talked about, trying to reduce that rib prominence and level your shoulders and hips as best we can, but also balance that with the risks for surgery. And so this is a typical posterior spinal fusion. When we say T2 to L2, T refers to the thoracic spine, L refers to the lumbar spine, where there's no ribs. Thoracic is where the ribs are. And these screws and rods, the screws are attached to the spine, and then they're attached to metal rods that pull the spine into a straighter position, and then hold it there, hopefully, for the rest of your days. It's sort of a typical spinal fusion. It could be with screws or hooks, or as Dickie will tell us later, some other methods. So this is my buddy Liam. He's a 17-year-old male. He underwent a posterior spinal fusion T4 to L2. I show this on purpose because it isn't a perfectly straight spine, and that's okay. We try to get as best we can, but it doesn't always have to be arrow straight. But more importantly, this is him in July of 2017. This is him in February of 2018. He went and swam, and he was a finalist as high school swimming relay. And then he went on to he was named the Pennsylvania State Comeback Player of the Year. Again, it's about 7 months after his fusion, which I thought was really cool. So the outcomes, one second, sorry, gang. The outcomes, so they're actually pretty favorable. And again, we'll get a little bit more insight to this on a personal level when Dickie talks to us shortly. But the long-term outcomes are about 25 to 40 years, which the Setting Scoliosis Straight and Harm Study Group have been a part of, show actually similar rates of back pain if you compare them to matched controls, people, just everyday folks without scoliosis. How they do is actually quite comparable to folks in the general population. The long-term revision rates, having to go back for another surgery, is about 5 to 10% over your lifetime. So about 90 to 95% of these patients are actually doing quite well. And we like to say that fusion isn't the end. This is Stacy Lewis. She's a professional golfer and was the #1 golfer at one point. She had a spinal fusion when she was an adolescent. This is Lindsay Ellington, who's a model and had a fusion done as well when she was an adolescent, is obviously still doing great. So there are options, are there? There's anterior two-body tethering, and Madelyn's going to talk about that shortly. These are where the screws go onto the front of the spine. Instead of a metal rod, they're attached by a flexible cord. And the idea of that is to have the spine, quote unquote, grow straight, where the cord's attached to that tall side of the curve, and then the inside of the curve will hopefully grow faster, and these sort of wedge-shaped bones and discs will grow straighter, hopefully, over time. Our indications, though, there's a little bit indications are slightly more narrow for this, as the cord isn't as strong as a rod, so the curves are a little bit smaller at 45 to 65 degrees. The curves need to be a little bit flexible, which means when they bend from side to side, that curve will reduce a little bit. And then you have to have some growth remaining. It's meant to be performed on skeletally immature patients, or patients who still have growing left to do, because we want the spines to grow straight. Here's an example of a VBT patient before at 6 months, and then 5 years after. You can see how that curve is corrected somewhat and then continues to progress over time and improve. This is one of those double curves. That was a C-shaped curve. Now we got an S curve where you can see that's correctable as well. But there are potential problems. Sometimes it can work too well. This is a patient at 6 months out, and after a year and a half, they grew more than we thought they would. We actually had to go in and cut the rope because it overcorrected, went too far to one side. There's another potential issue where the tether can break. So this is a patient who was looking great at 2 years, and then all those bones sort of grew straight, except for the bottom one, where you can see there's a little breakage of the cord. And then, unfortunately, at that one level, the bones didn't modulate or grow straight, and the patient had to come back for revision. So it's not a perfect surgery, but it can be a potential option, and it's successful for many patients. In 60 to 95% of the patients we've done, there's about a 20% risk on average or so, 15 to 20% of patients who may not have acceptable results or have to come back for another surgery. So it's a great option, but certainly nothing is perfect. And what are the long-term outcomes? Well, that's what the Setting Scoliosis Straight Foundation is a part of. There's a large collection of centers from around the world that are contributing data to this, so we can help really learn and see how these patients are doing in the short and the long term. And lastly, we'll just touch on motion preservation, because that's why VBT was brought to the fore. And every patient wants to be able to do this. I was never able to do that, but can it work? So we went to the lab and want to try to figure this out. And there's a number of studies done with us at Shriners, but also with Michelle and the crew at SSS, looking to see how these patients move after surgery. So we bring them to the lab and we put all these stickers on them and try to assess how they're moving. And we found some really good information that looks at how the patients move. And these bars show how much you can move. So the higher the bar, the more you can move. And if you'll see, the blue VBT lines move pretty well, regardless of how much surgery they get, how low you go. But the orange bars do tend to get a little bit lower. They do lose motion the lower down to your back that you have to fuse. So is there a way we can combine forces? Can we do maybe the reliability of a fusion in the upper part where you move a little bit less in your thoracic spine with your rib cage, and then leave that lumbar lower back curve alone and put a tether down there to save motion down there? So this is a patient that had a fusion of her upper back or thoracic spine where there's not as much motion. And then we try to have the best of both worlds where we tether the bottom. And here she is about a year post-op. So this is something that's new over the last several years. We're trying to see if this might be another alternative option. So just some take-home points, some pros and cons. Tethers can maybe maintain more lumbar spine motion. They have smaller incisions on their side, and they're able to return to sports and activities. Some potential drawbacks: it does have a higher reoperation rate relative to the fusion. It does involve thoracic surgery and has a good but less reliable curve in rib prominence correction, because we're relying on that remaining growth. For the fusions, we kind of know the long-term success is about 90 to 95%. It does afford a bit more of a reliable curve correction of that rib prominence. But similar to tethering, the vast majority of these patients can get back to sports and activities. The downside, it is a potentially longer midline incision on the back, and there may be some motion loss if you're fused below L1. All right, thank you very much, guys. We'll stop sharing.
All right, thank you so much, Josh, for that. Kind of waiting for some of these questions to come in, and so I thought there was,
right? So comprehensive.
I know, right? It is. There's a lot going on. So I think that tethering certainly is one of the more exciting innovations that have come up in scoliosis treatment and surgical management in recent years, and the sort of the holy grail of treatment of scoliosis is the ability to kind of treat these curves without the need to fuse and lose motion. So much of orthopedic surgery really is to try to preserve motion. We see that in total joint replacement, which is really one of the most successful orthopedic surgeries that are done out there. And we just don't have anything like that. We unfortunately are, in a sense, a fusion is a failure. But as you said, there's a lot of like the indications for tethering are really not the same, and they're a little tighter. Maybe you could talk a little bit more about that. Like for you, what do you see as your sort of ideal patient to get a tether?
Well, I think any surgical patient, we want surgery to be the treatment of last resort. So ideally, you want to see that the patients have tried their best at bracing, and we're going to have one of our speakers touch on that. So if despite all those efforts, the curve is progressing, then surgery is a potential option. Sort of the ideal one is a patient who still has some growth remaining. So for the ladies, if they're just before their first period or shortly after, that's usually indication that they have enough growth left, where we might be able to help those bones grow straight. But curves that are too big or too small may not be able to be corrected sufficiently with the tether. So usually curves above 65 degrees generally may be a little bit too big to reliably fix with a tether. Also curves that may be stiff, and it's not if the patient is stiff or not flexible, but the curve itself, when they bend to the side, does it help to straighten out a little bit. So those curves that have some flexibility to it aren't too big, about under 65, then patients who have some growth remaining are sort of the ideal tether candidate.
What what have you seen as far as recovery after surgery between, let's say you have two patients with a similar amount of spine that has been operated on, whether it's, thoracic or the thoracic and lumbar, the single or double curves, with the tether versus the fusion. Do you see a significant difference in their ability to get home from the hospital and get back to activities?
I think as of late, there's been a big push to really get kids and patients up and moving, both the fusion and the tether patients. And I think everyone's done a great job with that. So while there is probably a slight difference, I will say the tether patients probably are feeling great maybe a few weeks before the fusion patients. It isn't a dramatic difference, maybe by a matter of weeks. We used to think it would be by a matter of months. But everybody's goal with tethers and with fusions is to get everyone back to normal as quickly as possible and back to all their activities. So I would say probably a matter of a few weeks, but in the grand scheme of things, not a dramatic increase.
Okay. All right. That's really interesting. Okay. I think in the interest of time, we should probably start moving along. And I think next up, we're going to hear from one of the original patients that had spinal fusion with implants, and that's Dickie Davis. So she's going to give us her story from after her surgery, which was done in 1962.
Thank you. Thank you. Let me bring up my slides. There I am. There I went. Let me find me again. So it began in 1962 when I was 11 years old in sixth grade. And these are some other pictures of me then. My diagnosis back in my era, nobody knew much about scoliosis. They certainly didn't check us in school or anything like that. And in my home, we had a tradition that my mom would tuck me in at night and she would put her head on my chest. We would say some prayers. And evidently one night she heard my heart raging in a way that really petrified her. I don't remember any of this. And she took me to our town doctor and then orthopedist in Jacksonville. This was in July of 1962. And the doctor said to my mom, you need to take her to Houston, Texas. I've just read in the Bone and Joint Journal about an amazing man who is developed a technique that is the gold standard of scoliosis. So off we went to Houston, Texas to see Dr. Paul Harrington. Dr. Harrington had been featured in the front or in Time magazine a few months after that for his astounding work. So my dad threw me and my mom and me in the back seat and drove to Houston, 1,000 miles from Jacksonville Beach. And the back seat of a Carmen Ghia, which was our car, was a teeny little thing where you were supposed to put luggage. But instead, I was pretzeled in and off we went. My surgery was in 62. Harrington rods, which were stainless steel back then. Dr. Harrington developed them in his garage, originally for polio patients. My curvature, my fusion is T5 to L1. You see my X-ray on the left, and then my straightened spine with a little lumbar is still curve. My hospital stay, which I found astounding, was 25 days, 25 days away from home. My mom stayed with me. Ultimately, Dad had to go back to work. I didn't get up or walk for 2.5 months. The only time I got up was to fly home to Houston, which I vaguely remember. And I was casted in a cast, a plaster Paris cast for 3.5 months, which was really, really something. These are the original handwritten notes of Dr. Harrington. It talks about my surgery. It talks about my casting, which was 18 days later. And then ultimately I began to be able to walk for 5 minutes a day, 3 days, 3 times a day. 3 times, for 5 minutes. That was it. They would get you up back then. I don't know how it is now with the log roll, and they would pull your neck. And I used to think they were going to snap my head off when they did that. So I'm back at home in Jacksonville Beach. I'm there on the left. And, I was given the most state-of-the-art technology, so much so that my school or my city newspaper wrote me up. Scoliosis patient goes to high-tech to school in a high-tech way. And that was a giant squawk box. And they'd hook me up in my classroom and I would hear all this like intercom noise. Somebody would say, "Good morning, Dickie." And I would push my little button and I'd begin to talk. So that's how I went to partially to 7th grade. And on the right is the newspaper staff, because it wasn't bad enough that I was 11, that I had scoliosis, but now I'm doing some other really odd thing by going to school in a box. This is a picture that has a lot of meaning for me. This is Dr. Paula Harrington on the left, casting a patient in 1962. I got this from the archives at the University of Kansas, and it freaked me out because this looks pretty much exactly like me. I can't say that it is me, but it certainly is interesting to me. You can see the board, and it's a little bit of a scary contraption, which I'll talk about in a minute. How's my time? Not too good. All right, let me blast through the rest. I have a normal life. I had an amazing normal life with every possible great thing you could imagine. My husband and I have been married 44 years. I had a phenomenal career. I live in Florida, and my life has been great. I wanted to just say that the process of advancement in scoliosis treatment is amazing. From what I went through to the posterior spinal fusion, and then the tethering, which I know others will talk about. So thank you so much. I really appreciate this. And I will take questions, I guess. Or what will I do?
You're doing great, Dickie. That was great. Thank you very much. I mean, what an amazing journey you've been on. And as we were talking before, Dr. Roye and I were saying that Dickie was likely one of the first, or initial few Harrington rod patients, because that's right around the time where it came out. So you were a true trailblazer, and it's such an honor to be able to hear you share your story with us. So thank you. We're waiting for any questions to come on. There have been a couple adults that have sent in some questions, so maybe to address them. What sort of advice would you have for patients who went through scoliosis surgery, several years ago, maybe in the 70s, 60s, 70s, or 80s, and then maybe having some challenges now? I know that, we talked about, a lot of these patients do well after surgery. You're clearly doing well. What advice might you have for adult patients out there who are dealing with scoliosis?
Is that my question?
Yes, ma'am.
Oh,
yes,
wow. Makes it sound so much like I'm a doctor here. I don't know. I know many people now who have scoliosis, and we're talking about people that are asking about uncorrected scoliosis.
People who have had surgery, when they were younger and now are an adult.
Yeah, I tell you, I think the number one thing is to keep moving. I've done Pilates and yoga and have an incredible strong core and move, including meditation and breathing and anything you can do to get your body in a good place. But
that's great. That actually just came up, if I may. I want to say, like, how do you have any issues with your mobility? Any pain, aches or pains from time to time? Not at all.
I've been very, very fortunate. An occasional sciatica thing, or maybe my neck, a little whatever. Above and below my fusion, there's a good bit of a degenerative process. Sometimes I wonder how much is regular aging and how much is, because of the surgery. But no, I've been extremely lucky. Thank you.
Oh, that's great. All right, great. So now we're going to move on to Riley Sullivan, who's going to tell us what it was like wearing a brace for 6 years and then having to have a spinal fusion.
Hello, all. I am 16 years old, going into my senior year of high school, and going to share my story with you now. Okay, to start off, at a very young age, about 6 months old, I was diagnosed with a rare bone disease that manifested itself into kyphoscoliosis. At the time, I lived in New York City, so I visited Boston Children's Hospital to meet with Dr. John Edmonds regularly. After moving to Pennsylvania, John Edmonds said you had to go to New Morris DuPont in Delaware, where I saw Dr. William McKenzie and Dr. Sukin Shaw. Bracing. I was braced for approximately 20 hours a day for 6 years before my first surgery. Before my first surgery, I was also casted for 3.5 months to keep my back upright and straight. My first surgery was February 2015. I was in second grade, and it was my first surgery to implant magnetically controlled growing rods. And here are photos to the side. My second surgery was July 2019. I was entering 7th grade, and my first set of rods reached their max capacity. Dr. Shah removed my old rods and implanted new ones. After the second surgery, I had my final surgery. It was a spinal fusion freshman year of my high school. This surgery removed my second set of rods and put in 2 rods for life and 18 screws. This is my final surgery and my third one. I wanted to share my x-rays from before and after. So before is before my first surgery in 2015, and after is now, today. There's 2 rods and 18 screws down my spine. I've regularly attend physical therapy to this day to help my pain. I do acupuncture, cupping, dry needling to help me manage my pain regularly. My life now looks pretty amazing, though. I love to work at my healthy food restaurant where I sell wraps, salads, bowls, and smoothies. I love to socialize with my family and friends. In addition, one of my favorite things to do is go to country concerts. I love to travel. I went on a service trip this year to New Orleans to help the less fortunate. I also went on a retreat, a spiritual retreat for 4 days where I was apart from life, and it was amazing. Now, why is scoliosis research important? Research and medical advancements had a significant impact on my life. I was one of the first few patients in the U.S. to receive electromagnetic growing rods. They saved me from unnecessary surgeries and potential infection. My ability to live a more normal life, limit the amount of missed school, and continue functioning in sports and after-school activities was made materially better as a function of my electromagnetic growing rods. Any advancements that can be made in the surgical and recovery process would be hugely beneficial to future patients as the process is tough. And that's all I have.
Right. Riley, that's an amazing story. You went through so much for really, almost your, entire life at this point. Your treatment started when you were just a little girl. Do you have memories of what it was like being casting, back when you were in elementary school?
I definitely do. I went to a small Catholic school, so I remember the day I got casted. I went back to school with my little uniform on top of it, and my entire class signed it. So, yes, I really do.
So at that age for you, it wasn't you didn't feel self-conscious about it or anything like that.
No, it was definitely, being honest, it was definitely uncomfortable at times. Like if the brace was too tight and I ate after, it would make me sick. But I got the hang of it quick, obviously. But I had a great friends and a great family who surrounded me and supported me at a very young age to feel more comfortable.
Yeah, I think that's so important because bracing can be really hard on patients and their families, and having a really strong support network, I think, is really, really important. And it's great that you were able to have that.
Yes.
You were pretty young, obviously, when you had your first surgery, and that's because you had, you had such a significant scoliosis that the brace was just unable to control, is what it seems like. You were seeing amazing surgeons both in Boston and in DuPont. I know all those people quite well. So so how old were you when you had your first surgery? You're
I
about
was
7?
7.
7, yeah.
Mhm.
And how did you feel going into that first surgery? Do you remember?
I definitely don't remember that much from my first surgery, but I definitely remember, like, I remember the second surgery to the third. I remember, the fear of heading in, knowing, what's to come. But my memory is kind of faint from the first surgery,
Yeah.
for sure.
It's funny you say that, because there's certainly a lot of research. We talked about the importance of research, and I think one of the things that we've shown with our research is that repeated surgeries do cause exactly what you're describing, which is the first time you don't really know what's going on. The second time it's like, oh, I remember that. I didn't like that very much. And for kids that need multiple surgeries, it's hard. And so, doing a lot of the research that we've been doing through the Setting Scoliosis Straight has really been instrumental in helping us minimize those surgeries with things like the magnetically controlled growing rods that don't need surgeries to lengthen. So that's awesome. All right, I think we need to move on to the next section. And we have Maura here to talk a little bit about her experience with a spinal fusion, I think, without having the preceding surgeries or bracing. So we'd love to hear your story, Maura.
Yeah. Let me share my screen. All right. So like they said, my name's Maura. I was diagnosed with scoliosis in 2009. I underwent spinal fusion surgery in 2011. I'm here to share my story with you all today. So I was diagnosed in August of 2009. It was at my 5th grade physical appointment. I had that common experience of my pediatrician asking me to bend over and touch my toes and then staring for a moment and then telling my mom we needed to go get an x-ray. And so then got the x-ray and was confirmed that day that I did have scoliosis. So a couple months later, I started wearing a brace throughout the time that I wore the brace. So I was a swimmer. I started swimming, I think in like 3rd grade. So I was able to continue swimming, obviously not swimming in my brace, but, just took it off for practices and of the such and never really had really any issues throughout the time that I wore my brace. Unfortunately for me, though, in the summer of 2011, my curve had progressed to 52 degrees. So at that point, it was decided that surgery was kind of my only option. So I had my surgery November 15th, 2011. I unfortunately had not the best time in the hospital, not due to the hospital, just due to myself. So my recovery time in the hospital was really, really difficult. But fortunately for me, like as soon as I got home, it was a complete switch. Like the night I got home, I was infinitely better, feeling so much better. So fortunately for me, my recovery only went up from there as soon as I got home. So I was really restricted in what I could do for I think it was like 6 months. And then after 9 months, I could get back into like running and things like that. But I wasn't actually able to start swimming again until I believe it was 12 months after my surgery. So just very candidly, I think one of the things that was really I kind of lucked out on was that my entire spine was not fused in my surgery. So I retained a large majority, if not all of my mobility in my lower back. So a lot of the motions of swimming, like flip turns and diving and all those sorts of things, I never had an issue with continuing to do that after I got back into swimming. So like I said, it was about 12 months after I had my surgery that I started swimming again. It was not like an immediate thing. It was definitely very gradual. I'd go back 1 week and like swim for 10 or 15 minutes. The next week it was 20 or 30. And I also was working with a personal trainer. I swam at the Y, and so at the Y, they had a personal training program for the swim team. And so I was able to work with someone there to kind of help retrain and help build back up the muscle, specifically for swimming that I would have lost over the course of the 12 months that I wasn't doing anything. Ever since then, though, it's continued to just go up from there. So I swam all 4 years of high school. I played water polo all 4 years of high school. I did all the normal things. I went to prom, I graduated, I went to college. I graduated college, moved across the country and got another degree. And then I got engaged last summer. I'm getting married this September. So scoliosis definitely does not have to stop you from living the life you want to live. So when I was diagnosed, there really weren't a lot of resources available. Social media was not really a thing. It hadn't really come around yet. And so I really did not have that sense of community. I didn't know anyone else with scoliosis. And so supporting scoliosis research and educational, programs like Setting Scoliosis Straight is so important. I love that now all you have to do to find a community is a quick Google search, and you can feel supported immediately. So continuing to support scoliosis research is so important so that new patients can feel supported throughout the entire process of having scoliosis from, your initial diagnosis all the way through to having hopefully better and less invasive surgery. So that is all from me. I just want to say a huge thank you to Setting Scoliosis Straight for inviting me and allowing me to share my story today. I have my email if you have any other questions you want to follow up with, as well as the link to view my full story on the Setting Scoliosis Straight website.
Maura, that was awesome. That was awesome. You make me feel incredibly lazy, all the things you've been doing, and you had a big back surgery and you're still going. So, sleep when you're dead, that's fantastic. You're a true testament to just what you can accomplish, even after a big back operation. So I love your enthusiasm, your drive, and everything that you're doing. So this is fantastic. Thank you for sharing it. We give advice to patients, and this comes from middle-aged dad to some mostly teenage young ladies and guys, on what it's going to be like. What would be your best piece of advice to someone who's in your shoes now in 2024, who's the you in 2015? What were you most worried about? And what would you give some advice to those who are on the cusp of maybe having to do that? How would you help them?
Yeah. So I think the first thing I would say is just to remember that none of it is your fault. I remember like after my surgery, there was one night I woke up like crying, thinking like, if only I wore my brace more, like I wouldn't have had to do this. It's not your fault, so don't blame yourself for any of it. And secondly, just to acknowledge that you're gonna feel like a range of emotions throughout this time. I remember like when I was first diagnosed, I was like kind of excited because I was like, my friend, broke her knee and she got to ride the elevator in school. This was going to be like my elevator moment. So you might, feel some excitement at some things. There's going to be other times that are going to be really hard and really difficult, but it's okay to feel like all the range of emotions that you're going to feel throughout the process and throughout your journey through this.
That's awesome. Great advice. And was there something you were the most worried about that when you went through it, like, okay, that wasn't as bad as I thought? And then on the flip side, was there something nobody told me about? I wish they would have told me, beforehand.
Yeah. I think the one thing that, I don't know, this might sound a little weird, but the one thing I think no one told me about, I think as an adult looking back on it, I didn't realize how much like pressure was also on my family, and especially on my parents. So just give your parents a hug. They're also going through a lot right now. Just hold them a little tighter because your support system is really everything going through this. And sorry, what was the other part of that question?
Was there something you were worried about that in the end wasn't actually as big of a deal as you thought?
I think honestly, just wearing the brace. I think when I first started wearing it, I was like, oh, let me try to put it under stuff and try to wear clothes to hide it. And then it just got to a point where I was like, whatever, to be honest, I'm a youngest sibling. I love the attention. So I was like, yeah, people can come up and ask me about it. Like I can tell them all about it. I could talk your ear off about scoliosis when I was a 10-year-old. So yeah, that was probably something I was worried about. And then I think my scar too. I love my scar now. I showed it off my prom dress. I'm showing it off my wedding dress. So it's probably one of my favorite parts of myself. I've never, hated it for a second. So
I love it. I love how you've embraced it. That's fantastic, literally and figuratively.
yeah.
All right, great. Thank you very much, Maura. And we're going to go on to, last but not least, Madelyn, who's going to talk to us about her experience with vertebral body tethering. Take it away.
Thanks. So I'm Madelyn, I'm 13, and I'm going to be sharing my journey before, during, and after VBT or vertebral body tethering. So in 2021, I was 11 and I didn't know that I had scoliosis, so I didn't do any bracing, and I got my surgery the same year that I found out. So it was only 5 months from when I found out to having my surgery. And my family and I were all really shocked because I had a huge S curve that was 47 degrees on the top and 57 on the bottom. So they said I would need surgery. And we met with my doctor in Denver, who said that I would actually have to have my back fused as soon as possible. But my mom heard about VBT as an option. So we ended up flying out to Philadelphia to find out if I could do it. So we met with Dr. Pahys, and he said my curves had increased, so I could do either one. And we knew I wanted to try VBT if I could, because I wanted to keep my flexibility since I was a dancer. And I also wanted to keep growing since I was only 4'7" at the time. So I knew that if tethering didn't work, I could go back and do fusion. But if I did fusion, then I couldn't try VBT later. So I came to Shriners Hospital 10 weeks later for my surgery, and I found out that my bottom curve had gotten 5 degrees bigger to 65 degrees, and my top was at 55. So in the middle is my before and after picture of the surgery. And during my surgery, I feel like trusting your doctors is going to help you through it, because I had already met Dr. Pahys, and then meeting the other doctors and nurses, I could see that like they knew what they were doing. So that made me feel just better about getting through the surgery overall. And I was also excited to find out that I had grown 2 inches. So the next morning, I got started covering really quickly. So I did 2 breathing exercises every hour to help my lungs heal, because during the surgery, they deflate your lungs. So I had chest tubes in me, which you can see pretty well in the middle picture. And they drained into these boxes called a chest drainage system. And in the same photo, you can see the nurses helping me go on my 3rd walk the day after surgery. And it shows that it was complicated to walk because we had to take all the equipment that was with us. I stayed really calm during my time in the hospital. And everyone would tell me that I was a great patient and stuff like that. It wasn't really like I was like forcing myself to be calm. I think just naturally I was like that. So the next day is when I discharged from the hospital and went to the Ronald McDonald House. This was a really accommodating place because they were helpful and provided snacks and drinks, and then breakfast and dinner meals. And they also brought in service dogs, which were really nice to see. So going home, the recovery back home was really probably the hardest part. It was hard to be motivated to keep doing the breathing exercises and eat when I wasn't hungry. But I started walking up and down my street. I was getting farther and farther every day, and my friends came to support me through that. I slept in a recliner chair for more than a month. I don't know if that was necessary, but I just felt the most comfortable in that chair. So for school, I got an elevator key, was able to leave classes early, and a friend could come to help me. I tried going back to school 4 weeks after my surgery. I couldn't make it all the way through the day, so I did half days and then did the rest of my work at home. At 5 weeks, I had my follow-up appointment with my doctor in Denver, and he had talked to Dr. Pahys, and they cleared me for anything I wanted to do. That was just based off of my pain levels. So I went back to dancing about 8 weeks. After about 8 weeks, I didn't think I would be able to compete with my team and do my solo only 4 weeks after coming back to dancing. But this was me 93 days after surgery, back on the competition stage dancing again. And I remember people telling me things about being careful with my back. And I would just have to tell them that I'm fine, which I thought was funny because I could tell that people were worried when it was like more recent after my surgery. And then the scars for VBT are like really small. I have about 4 on each side of my body. The biggest one is, I would say, about 2.5 inches across, but the rest, again, you can barely tell they're there. So I go back to Shriners each year to see Dr. Pahys, and here are pictures of me each time I went back. It's been 2.5 years since my surgery, and I'm still dancing all the time, and I have full flexibility through my back. And most of the time, I forget that I even had a surgery just because I'm really active. And I think it's important to support scoliosis research because for everyone, it's a life-changing thing, and I think we can keep finding better ways to treat it. So yeah, thank you, and I hope this helped for anyone considering VBT.
Wow, thank you, Madelyn. That's quite an amazing journey you went on, and so happy you were able to find Dr. Pahys so he could help take care of you. And you talked, I mean, you gave a lot of detail about your story, but don't see any specific questions, so I just wanted to talk to you a little bit more about it. What was it like when you got that news, when you thought you were totally fine and you go to the doctor and they look at these x-rays and they say, oh my gosh, you not only do you have scoliosis, but like you need surgery soon. Like, what was that experience like?
Well, I remember we went for one of just my normal checkups, and before I hadn't had like any of my school doctors or my normal doctors um do the little test for scoliosis where you bend over. So that time my doctor did it, and she was like, "Oh, you have scoliosis, but we won't need surgery." And then we went to the doctor again, and they said that I would. And I saw that my whole spine was just like curvy, and I was just really surprised. And I just like looked at my mom and we were like, oh, that's what my back looks like.
So you found yourself out east to Philadelphia, and I think one of the things which you touched on, which is so important, is sort of that relationship that you had with the people that were taking care of you, and that's what gave you, helped you feel better and helped get you through that process. What can you think of maybe some specific things that either Dr. Pahys or maybe some of the nurses or other people that you interacted with were able to do that were so helpful for you?
Yeah, for the nurses in the hospital, my like recovery was really good there because the nurses were just really nice to me, and like they were accommodating to anything that I needed, and they just got anything that I needed really fast. So, and then when I met Dr. Pay's, like we saw like other backs that he had done, and like that he was a good surgeon for it. So yeah, that what helped me.
Yeah, he's okay. We'll take it. I'm teasing, of course. He's
It was
amazing.
tall. That's all you can really say. But yeah.
He's amazing. Oh my goodness. All right. Well, I think we're right up against 9 o'clock. So I think we have a couple last little comments for everybody. First, thank everybody, all of you for giving your stories. We've been able to see here this list of stories that we just heard tonight, running the gamut from the like original scoliosis surgery with implants in 1962 all the way to this amazing VBT case that occurred almost exactly 60 years later, right? And all of this has happened, all of these changes have occurred over time due to research, and that research of course requires support. And we can't, all of this stuff is actually pretty expensive to run. So, and this goes to help supporting the research and the researchers and the databases and things like that. So if any of you felt touched or enjoyed what we were able to talk about tonight, and you want to express your appreciation, please consider making a donation to Setting Scoliosis Straight. You can go to the website, settingscoliosis.org, or text scoliosis to 41444. There's a QR code on the bottom of the screen that you can utilize as well. And again, everything is really greatly appreciated. Also, this being Scoliosis Awareness Month, we had a t-shirt contest where people would submit entries for the best scoliosis t-shirt. And we do have a winner. Dun, 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 drama, drum roll, please. Yes, so Sophia Barrios, a 12-year-old girl from San Diego, came up with this beautiful design with little scoliosis spines meeting the stems of these beautiful flowers and butterflies. She has severe scoliosis and is 8 months after surgery right now. And this is the winner of the contest. If we can go on to the next slide. You are able to purchase these t-shirts. Again, you can go to the website, settingscoliosis.org, or scan the QR code to visit the store for this and some other items. Additionally, I think a lot of people talked about resources and ability to find information on scoliosis. And this handbook, which has been created by members of the Harm Study Group, all surgeons who've dedicated their careers to treating patients and doing research about scoliosis, just released their 4th edition of the Scoliosis Handbook. It has a lot of new bracing information. Some of the things that I was able to touch on today talks about vertebral body tethering, like Dr. Pahys has talked about as well, and we heard some stories about that. Bandages and scars. It talks about future technologies, where we're headed in the future, in addition to many other additional resources. Additionally, we have our YouTube channel, the SSSF, Setting Scoliosis Straight Foundation YouTube channel. There is tons of information here. This webinar will be uploaded on that website in just a few days. It has lots of educational videos, helpful tips, research publication videos where we talk about different projects that have been done with the support of the foundation, patient stories and interviews, just like you've been able to see here tonight. A lot of FAQs, frequently asked questions videos, as well as other past recorded webinars. These are the another couple of patient education webinars to come forward later this year. A spinal fusion versus vertebral body tethering webinar, and this will be the final one. And you can visit the website for more information as far as when that is going to be released and who will be involved. After the survey, you will all receive a link for questions. Please take just a couple of minutes to answer these questions. This really helps us design these webinars to meet the needs of the people that are attending. And thank you all so much for attending. And happy Scoliosis Awareness Month to everybody.
Thank you all, Dickie, Riley, Maura, and Madelyn. Ken, thank you enough for sharing your stories bravely to help out those moving forward. I know it's a huge help to us and the patients out there. We can't thank you enough for your time and all your contributions to setting scoliosis straight. You know, how we take care of patients now is what we've learned from the past and will help us improve that care moving forward in the future. So really appreciate everyone. It's been an honor to be a part of this webinar. Thank you very much, Michelle and the team at Setting Scoliosis Straight. Very cool. So again, everyone have a great night. Thank you again. And another round of applause for our stars, Dickie, Riley, Maura, and Madelyn. Have a wonderful evening.
Absolutely.
Everyone. Thank you.
You're here.
You guys rock.